themselves created their own little sort of immunity by creating their own social lockdown, irrespective as to what the government was doing. Whereas the youth, it went in the other direction. Once the lockdown levels had eased, or the restrictions had eased, the socialization increased, and that unfortunately put them at risk. But the super spreader events definitely was just such a trigger for everybody, especially in terms of stats, because that one or two super spreader events shot our stats right through the roof, and then it officially declared it as the second surge.
That's true. But to dispel any myths or to confirm that this is true, does it mean that what we're seeing now is that the second strain is more infectious? Is that what has also happened?
Well, I couldn't speak to that with total confidence. I don't think it's any more infectious than the first strain. I just think that a couple of events coincided with each other. I think our lockdown restrictions eased, and we saw in Europe the countries that had their first surge peak much earlier than South Africa. They started having a rise in cases as well, and because it followed their summer months, and also sort of seasonal and social events that would create a super spreader kind of situation. And so we saw their second surge, and we saw this consistently with every country that had their first surge before us. And we all started to wonder, is this just the way the virus behaves? And it seems so. And then the second strain came about here in South Africa and in the UK. We were the first to discover the second strain, and there is some evidence that the strains are not even the same between the UK and SA, so that's even more concern for us. And then, so you have the second wave that seemed inevitable, and then you had the second strain, which was a new and novel discovery. And I think it was just a series of unfortunate events that came together from a very personal point of view. So I don't think the second strain caused the surge itself. I think the surge was always going to come, unfortunately. I think the second strain is just another challenge that we are now being pitted up against.
A very strange and weird time to be in the medical profession. We always say that now is the
Sure.
craziest time to be a medic or any frontline worker. It's quite a difficult and
Sure.
challenging period of time. If you're just joining us, it's just gone 19:11, and you're listening to myself, Dr. Deshni Chanan, on Medical Matters on Capital Radio FM 88.1. So today we're talking about COVID-19 in pregnancy, and in general to talk about the obstetric case and how COVID-19 may affect these types of patients. So in studio with myself is Dr. Cassandra Govender, who's an obstetrician. So if any of you have any questions regarding COVID-19 and pregnancy, or if you're querying it for a friend or a family member or yourself, you can always get a hold of us on 065 421 where Dr. Govender is more than happy to answer any of the questions that you might have. And remember, you can always join us on our Facebook, where we're currently streaming live, as well as our Mixcloud and Radio Garden apps. So getting back into it. So if a patient is pregnant and has now come into contact with somebody with COVID-19, and I've seen this happen when I've been at our STT centers and we're screening patients, and a mom will come saying, listen, my dad now tested positive and we all are in close contact. And frantic, what do you do?
So, Desh, I want to say my heart really goes out to any pregnant mom who now has the additional stressor of COVID to deal with, especially over the last year. So you expect that this patient, like you said, is going to come in with a lot of anxiety. And I think at the get-go, we need to deal with her with an air of sensitivity and reassurance. So we know, as defined by many guidelines, a close contact is anyone who you may reside with or you were in contact with for 15 minutes or more, etc., etc. That's been established. When these patients present to us, we offer reassurance and we screen them for symptoms. Now, the trick or the emerging evidence now is the timing of testing. So if a patient is symptomatic, and by symptomatic, just to run through it again, cough, shortness of breath, fever, or any new inflammatory or infective symptoms, including gastrointestinal upset, she immediately triggers as a positive screen, and she, in the background, especially of having a positive contact, would require a swab.
Mm-hmm.
However, if this very same pregnant mom came to me and has no symptoms but has a close contact, there's so much of evidence now that early testing is going to reveal a false negative, and this mom could easily become positive later. So the new guidelines are advising that if you are in close contact with a confirmed positive, you should self-isolate for 10 days. So the same applies to this pregnant mom. What does that mean in terms of her pregnancy? So obviously she's got antenatal appointments. She's concerned about the health of her baby. The first thing we need to do is, if she's asymptomatic, otherwise well, we assess her ability to isolate at home. So can she remain in an area away from everybody else with access to a bathroom facility and access to refreshments, food, etc., without coming in contact with a COVID positive patient? If she can, then we advise her to do that and to self-observe. So if she develops any of the positive COVID symptoms, then she needs to come back to us for a test, and we assess her then from a clinical point of view again. If she can't self-isolate, then we keep her in our facility. We don't ever want a pregnant mom to ever feel anything but supported. So we have a facility in the hospital where we keep them, and if you look across the province and across the country, there are multiple facilities in place for self-isolation for a PUI who cannot do so at home, or for a stable COVID positive mom who can't isolate at home. What we want for this mom is to reassure her, but we also don't want her to develop symptoms and complications at home without knowing that she can seek medical help. So if she self-isolates, the main premise for us is to ensure that she knows who to contact and that she can come back to our facility anytime, day or night, if she develops symptoms or if she's concerned about her baby in any way.
Okay.
And I think that's the most important thing.
It's very scary. I've seen lots of moms come in and where, they are quite frantic and quite nervous because pregnancy comes with its own set of,
Absolutely.
worries and challenges as to whether
Yes,
everything is going to be okay. So like you're saying, if a mom has come into contact with somebody, you don't have to rush in for a screening. Like Dr. Governor is saying, it's such a tricky virus. You sometimes miss that you in this window period if you haven't started to develop any signs and symptoms. So sometimes you're going to get this false sense of reassurance when you go get a swab and it's now negative. So, and you might actually still be harboring the virus. So, the best option for you at that point is to wait, self isolate, because you obviously have come into a contact that is positive. And remember, a contact is any time you spend 15 or more minutes with somebody that has been positive. So, if that happens, you self isolate for 10 days and you monitor yourself. And if you find within those 10 days you are now starting to have signs or symptoms, then you come back in and you get swabbed, and this will give you a definite diagnosis to whether you are positive or negative. So in terms of a patient that now comes in and we've done it, and now the test unfortunately has come back positive,
okay.
what happens
So,
to this patient?
so so the same rules apply. Oh, Desh, I must just apologize to your listeners for all my sniffling. My sinuses are flaring, so I apologize for that. So a COVID pregnant mom, a COVID positive pregnant mom, we basically divide them clinically into two groups. Is this mom symptomatic, or is she asymptomatic? And you actually have moms who have come in contact with someone who developed COVID and then they have no symptoms whatsoever. They actually, some of them disbelieve their own swab result, which is quite ironic, but I think in great favor for that mom. That mom is again advised or assessed for self-isolation. If she can stay home and if she can continue to take care of herself, then we do so. We send her home with a multivitamin pack, some good advice just to hydrate, to rest, because fatigue is a big symptom of COVID. And we give them our telephone numbers of our wards to please call in if they are unwell. And we also tell them what should trigger them to come immediately to the hospital. For the mom who is symptomatic, we're a little bit more worried or concerned, and we're careful about that. a symptomatic mom we admit in our facility. The reason that we do that is because we must be fair to the fact that resources are limited and patients don't have easy and quick access to a health facility. So if she's already displaying symptoms, and she really warrants the benefit of a clinical observation. So we admit her to our ward and we start on what we call our COVID protocol or our COVID cocktail, and we do the necessary investigations. At this point, the question is this mom a mild COVID positive? Or does she fit into the spectrum of moderate to severe disease? And, there are certain clinical premises upon which we base this diagnosis, and that drives our management plan moving forward.
Okay, I have a question. So, if a
Yeah.
patient is positive, but you're saying not displaying symptoms, you then give them a cocktail of multivitamins.
Yes.
Okay, so when you are symptomatic, and that's with the cough, the fever, respiratory distress, then you are admitted, and then so generally what happens at hospital, we have a protocol in which we trigger when a
Yeah.
patient comes in and gets an admission for COVID positive, and all departments have this. It's just that we have our own cocktail that works in. So if a patient is at home and does not want to be admitted, and you find this a lot because patients are scared and they don't want to come and be admitted into the ward. We find this happens quite often. So in terms of antibiotics and pregnancy, are you able to take any, do you normally give, because it is part of our COVID protocol where we generally do give antibiotics to patients. So how would this
Sure.
work?
So if a patient warrants antibiotic use, and Desh, I want to say this without confusing the issue.
Yeah.
What we find is that most of our pregnant moms have had mild disease. They are presenting almost asymptomatic to mild disease. That's a large percentage of the positive pregnant population. So I agree, and I see where your thought process is going. We hesitate to use antibiotics in pregnancy unless we absolutely have to. So if the mom is asymptomatic, she does not require antibiotics. If she has mild symptoms like a little bit of a sniffle or a cough which then resolves almost immediately and her chest is clinically clear, in other words, she doesn't have anything when we examine her to suggest a developing pneumonia, she doesn't require antibiotics. The thing about COVID, and the thing that scares us all as medics, is that a COVID pneumonia is a raging condition. Once it starts, it runs. And our control, the premise upon all our treatment is to gain control as early as possible. So once a mom presents with a fever or a productive cough or chest signs on examination, that mom immediately warrants antibiotics because we cannot afford for her to develop into a full-blown COVID pneumonia, and that's what the antibiotics do. Is this going to hurt her baby? The antibiotics that we prescribe are relatively safe in pregnancy. We use them for the treatment of pneumonia in pregnancy in general and for other infections as well. So it's not like this is the first time we're using it in pregnancy because of COVID. It has been tested and it's relatively safe in pregnancy. There's just a concern about using it in the patient who is closer to term or about to deliver, because the antibiotic then, it's a whole complex process of exposing a baby who's about to be delivered to this antibiotic. But in utero, and if we're sure she isn't going to be delivered in the next 10 to 14 days, it's a relatively safe process to go with. Even so, if a mom comes at term with a COVID pneumonia, we will give that mom the antibiotic, because the way to keep your baby safe is to keep the mom safe. And the only way to treat a COVID pneumonia is to go hard with the COVID protocol, which includes antibiotics.
Okay, so that actually brings me to the next question. I am now COVID positive. How is this affecting my baby?
Now, this is the best news possible. So far, I like the term the novel coronavirus. Novel, I like using that term because it truly is novel. It's so brand new that everybody's still trying to find their feet. So to be fair, when we look at studies and reviews that have looked at COVID in pregnancy, they are few and far between. But the largest review was done in the UK. They looked at all their pregnant moms and whatever, that was a significant number. And the great news is that there is no direct effect documented. There's not evidence enough to say that COVID either one increases the chances of a miscarriage or affects your baby in terms of development or congenital abnormalities or affects delivery. So as it stands, COVID does not directly affect the baby. But I just want to add something to that because I don't want to be taken. I don't want that to be taken at face value. Somebody is going to turn around and say, "But Dr. Govender, we know of moms who've had to deliver early because of COVID," and that is the truth. The early deliveries or the preterm deliveries have mostly been iatrogenic in order to respond to the mom's clinical situation. So in order to bring the mom into a clinically stable zone, we've had to deliver earlier. Not at all for the babies. In general, if a pregnant mom comes in with a pneumonia, let's take COVID right out of the picture. If she comes in with a pneumonia, if she comes in with a severe urinary tract infection, or any infection from whichever source, that mom is automatically at risk for what we call a preterm delivery because the inflammatory process automatically affects the baby. So you've got this inflammation happening, and this mom's got the heart rate going at it, and she's got a fever, and she's not well. So the baby tends to react in a very similar fashion. And as you know, we monitor the babies inside the mom or in utero by doing what we call a cardiotocograph, which is a trace of the baby's heart. And that trace is actually what tells us whether the baby is well or not. And that's all we've got to use to follow. So if that shows that the baby is not too happy, that may also result in an earlier delivery. So to bring us back to COVID, we monitor the babies aggressively and within obstetric guidelines. And if the baby's not doing well, it may lead to a preterm delivery. But so far, there is no evidence for a direct impact on the baby. Now, obviously, the next question is, can my baby get COVID if I have COVID? Can my baby get it inside? There's only been one documented review of one pregnancy where there was traces of the virus, COVID virus, found in the placenta, in the fluid around the baby. And when the baby was tested immediately after delivery, that baby was COVID positive. The great news about that is the baby had some sort of inflammatory process for about 2 days and recovered completely. So that's great news. Currently, there's no other evidence that the virus passes from the mom through the uterus to the baby to cause a baby to be born unwell from COVID. So I think that's a really important thing.
I'm so glad that you actually mentioned it and explained it into such detail, because pregnancy on its own is such a it's such a tangible thing. It changes constantly, and you have to watch patients. And this is, like you said, when you even take COVID out of the picture, it is what happens in a normal pregnancy. You have to be very
Absolutely.
attentive, and you have to watch because conditions change. It can be very volatile at times. And like you said, we monitor it very closely. If you're an intern and you know, if that CTG is not doing what it wants to do, your heart literally jumps out of your chest and you are in this panic mode. But we do that. We've been doing it even way before COVID has been around. So like Dr. Govender was saying, there's certain things, UTIs, pneumonias, any other infection that can actually prompt preterm delivery, any inflammatory condition. And like we said, COVID stands within an inflammatory process regime, and it's within that realm. So like we would treat it the way we treated any other inflammatory process. We monitor it the same way.
Absolutely.
And sometimes that might prompt a preterm delivery. But it doesn't mean that it's
Yes.
only exclusively because of COVID that we're doing that.
Yes, absolutely.
And so like Dr. Govender also mentioned, and the biggest fear has been for mums, and this is something I find, and your heart goes out to mums because all they want to do is keep their baby safe, and they feel so guilty that they now, before anything has even happened and their child is born, they now have COVID, and it almost feels like they have done it. And this sense of guilt is overwhelming, and it's so nice to reassure them that so far, in terms of research, there's, like you said, been one case, and the baby recovered within 2 days. So, if you take anything from tonight's show, it's that reassurance that in terms of statistics and in terms of facts currently, we haven't seen much transmission from mums to babies in vitro. and hopefully it stays the same and it doesn't change, going forward. But
For
with
sure.
our current
For sure.
sense and our current knowledge, that seems to be the information that we have. So, guys, it's
Absolutely.
almost halfway through the show. We are going to take our music break. Some of the songs are courtesy of Dr. Governor, and I hope you enjoy them. So, please stay tuned. There's plenty more to talk about within this topic. If there's any questions that you might have as a mom or you might query for a family member, you can please feel free to contact us on our WhatsApp line 065 So, I hope you enjoy the music and stay tuned. We will be back